Hi guys, it's Monday again, and you know what that means? It's Mamvazations Monday! Na leo nataka tuwekewe editor aike hapo drum rolls. Guess who's back? Hey! Lisa is here with us.
Our favorite OBGYN.
Oh, I know. Leo tunamambishana other questions.
Yeah.
Tunataka atu educate even more.
Hii ndio tulikuwa tunataka hii episode.
Hii episode hii tumeingoja.
Na hii mtafurahia.
Yeah. But even before that, oh my God, Zoo. Aki, you people, thank you so much. Mmetufikisha 1,000 subscribers. Thank you. And because of that, ndo maana unaona tunawaletea sasa vitu mzuri. You know, we are gifting you people.
Babe, umesahau TikTok ni 20k followers.
Oh my God. Thank you. Tutafanyia nini hawa watu? Tutawafanyia nini?
Aki.
But at least last week tuliwa introduced to Malaica.
Yes.
If you didn't watch that episode, go back and watch that episode. Imagine Malaica is giving people for 449 bob only per month. 49 bob. 99 per month. Ama hiyo ingine nitawajazilia.
Discount code ni yake.
For 99 bob only per month, you get to be part of a society. They put you to be part of a society, and moms, you need that. Hata kama wewe ni mtu ati unashinanga peke yako, trust me, you need it. They open you up to psychological help. Imagine you 499 bob.
Imagine.
In fact, kama sahi hujakimbia kuenda kuwatafuta, something is wrong with you. Please make sure as I'm talking
you unataka kukula. Achana na hiyo kuku. Ingia kwa hiyo.
Imagine just pay this per month. You also get
a personal nurse midwife.
Imagine.
Who will be talking to you in the groups. So they'll be answering questions on the groups. And if you have any personal question, you can also reach out to them.
Imagine. And they're available from 9 a.m. to 9 p.m. Yes, enough time ya kuuliza all the things you can ask. And
for 3,999.
Yes, we have our clinics where you can come to the clinics. You get consultation from the OBGYN. You get lab tests that are needed. You get the ultrasound that is needed. You also get access to, again, the psychologist. Yeah. And for those who are further along, they also get access to one Lamas class in that.
Imagine.
Yeah.
Sasa nini nyingine unataka?
Ati Lamas. Mimi nikiwa na mimba nilikuwa nataka hizo vitu.
Imagine. Na hata me there are things ametaja hapa nilikuwa nataka lakini.
Should we do this again?
Let's mention the delivery packages.
Yeah,
we have delivery packages. We partner with Avenue Hospital where you pay 69,999 to go with a Malaica OBGYN for vaginal delivery. And if it's a CS, you pay 169,999 again with your personal Malaica OBGYN to deliver you.
Oh, I can bring my own OBGYN.
No, Malaica.
Yeah, a Malaica OBGYN.
Oh,
yes,
okay.
Yes.
And Malaica works with you from the beginning.
Yes.
To the
to
end.
now, not the end.
Oh, to
now.
even after.
Now.
Wow.
Yes.
Wow.
Yeah.
Kwa hivyo, by the way, they are working with Zoo. Zoo is part of a platform here. Na hata akuniambia.
I'm sorry. Inaitwa winning thoughts.
Nipewe tissue.
Babe, I'm sorry. I am sorry. I take full responsibility.
It is okay, but I think what you're learning there umekuwa ukileta huku.
Yes.
Nice. Now, without any further ado, we go into our discussion today. We want Lisa, our very beautiful OBGYN. Kidogo tuseme OBGYN. No, we have upgraded. We refuse OBGYN. What? OBGYN. Yeah, Lisa is here. We want her to take us through some of the danger signs during delivery.
No, not danger sign, complications. Am do the same thing?
Okay,
danger
complications sign? During delivery.
During childbirth.
Msijali Azu ni mtu wa academy. So we understand her.
Sasa what's the primary?
tumia danger signs. Sawa? Danger signs.
Fine.
Yeah. So she'll take us through that and so that we learn why people lose their lives during giving birth. And these things are avoidable,
Again,
right?
childbirth is a matter of you and
Life
the Lord.
and death. Let me tell you, when I was delivering, nilikuwa nishakubali naenda, nilikuwa nishakubali na go, nilikuwa nishajua mtoto wangu, my friends will take care of this kid. Like I was letting go. Aki sikuwa naona mbele, kwa naona tu giza. I was puking, I was going.
And then you pushed out the baby.
And then imagine, and I was okay.
And
But
you
then
said-
when you talk to Evie, I was fine. I was like,
okay.
oh wow, kumbe hivyo.
Can we have another one now?
I'm alive. Yeah, but it truly is a matter of life and death. I would agree, whether CS, whether normal delivery, you're never sure that mom will come out alive. The father is never sure whether atarudi home na both of them, one of them or none.
Because even with CS, nasikianga watu wanasema CS is rahisi sijui nini.
You're never sure.
Huwezi jua kama utaachwa na bandage ndani ya
And something happens.
kushonwa, because we've had such stories. Mtu alishonwa, then they shonad the small intestine by mistake.
Carelessness.
Hey,
Yeah.
stories, they really freak me out. Ama umeachiwa utoto, what are those bandages?
Gauzes, a gauze.
Hiyo inaitwa gauze, mimi naitanga bandage hizo.
Yeah, but I know what you're saying.
But even pia watu wa vaginal delivery, kuna mtu akikosha anaweza acha. That is just carelessness.
Yeah, so umeenda home but your nunu is smelling.
I know.
Unashangaa ni nini, kumbe unauza from the inside.
Imagine. Yeah.
So we have so many questions for
So
Lisa
many
here.
questions.
You can also post your questions hapo kwa comment section. I'm sure you will get time and respond, right?
Yeah.
So let's just start us off with her very first burning question.
So I just want to note at some of the most common complications during childbirth.
During childbirth. Yeah. So we have postpartum hemorrhage. That's one of the most common complications during childbirth. And it's also a common cause of death, maternal mortality. Yeah.
What?
Postpartum hemorrhage. So basically, when you bleed too much.
Okay.
Yeah, you bleed too much during a vaginal delivery. You can also bleed too much during a CS as well.
Oh.
And you lose a lot of blood. It's expected to lose blood. But if you lose a lot of blood, for example, a liter, and then now it starts affecting, because you've lost too much blood, of course it affects your blood pressure is low, your pulse rate is high, and so on. I mean, then it can just lead to death. So that's a common one. That's one of them. The other complications, there can even be infection after childbirth. Yeah, for whatever reason, even CS, sometimes people can get infections. We try to make sure that doesn't happen. We make sure the area is sterile, it is clean during a CS. We give you antibiotics even during the CS. So we try to reduce the risk of that happening, but it does happen. That is the truth during childbirth. Yeah.
And what would make someone overbleed?
So there are very many reasons, but if you look at it vaginally, first, if someone has history, so they bled a lot in the first one, then the next one, you can say that they're at high risk of that. If they have, for example, their uterus just refuses to contract. It's supposed to contract. Once you remove the baby, it's supposed to contract, become hard, and everything is out. So sometimes it's just relaxed for whatever reason. Sometimes it's relaxed because you had twins, or there was a lot of space there, or you've had many children before, so it's a bit bigger than usual, and then it loses that strength. It's like it's a muscle, so it just is like a flabby muscle. So because of that, you can just find that you're bleeding and bleeding and bleeding.
Is age also a factor?
Age is not a factor. Yeah. So it's usually the number of children maybe that you've had before. Maybe you had twins. Maybe it's a big baby. Other causes are maybe there's a piece of placenta that was left inside. Then you find that you're bleeding. So really, the uterus has to be cleared. It's like a machine. If the baby is out, placenta is out, everything else has to be out. Then it sort of contracts and closes. If there's something left inside, then it refuses to contract, and then you find now people bleed a lot. Or if they get tears Yeah, then of course they bleed a lot. You can bleed at the cervix inside, or even now those outer tears. They can bleed a lot, and then can lead now to postpartum hemorrhage.
So hapo kwa bleeding, is there a way to avoid all those things umesema?
There is. First, it's to know that someone has this risk factor. That's why it's important to go to clinic. That's why it's important to talk about your history, so that I know, okay, you had this at your last delivery. So now we know to expect it. We know that we have prepared blood in case of anything, and then there's special medication that we give, like syntocinon, oxytocin, which helps to contract the uterus. There are different medications that we can give in advance and during that time to now reduce that risk of you bleeding. We make sure that in terms of tears and all of those things, we make sure that we have keenly looked at them and that we repair those tears very quickly. Yeah, so there are things that we do. There's that thing of cleaning the uterus after someone has given birth. I don't know if you remember.
Me, I remember mine very well because it was
After
very
that,
uncomfortable.
It's very uncomfortable, but there's a purpose for it. It's someone is trying to clear everything, all those tissues from inside.
Kuimagine too. Because hata kwa pap smear, kuna venye una feeling hizo ni bristles za hiyo whatever.
So you do.
So let me ask.
So imagine sasa mtu akikuja.
So the whole hand goes in, right? Yeah, imagine.
It has to go in. It has to go in. Yeah, because your uterus is up to here at this point. Yeah, so it has to go in and you have to clear everything. So it's very uncomfortable, but it's helpful.
So as a service provider, how do you ensure hautaacha kitu? Do you clean as you look or unabahatisha tu mali mkono itashuka?
Very important.
You clean as you feel, because you know that the uterus is like this. So you know that there's this corner, there's that corner, there's on top, there's behind, there's in front, and then you now clear everything. Then you'll also feel that the uterus becomes hard, it has contracted. And then you see that there's no longer any blood coming out. Then you know, okay, then I've cleared everything.
So as long as it's not contracting, there's a chance I have not cleared everything.
Yeah, it's not been cleared, or it's just behaving the way it wants to behave.
You've mentioned kama hiyo story ya kubleed, you prepare in advance the blood.
Yes.
So how else do you prepare for complications? To reduce risk factor, how else do you, apart from now the blood? For example, mimi wa preeclampsia. How do you prepare me for my delivering to deliver my second born?
Yes. So preeclampsia, for those who might not know, is when the blood pressure is extremely high, but there's also maybe protein in your urine, and then there's can be damage to your organs, like your liver and your kidneys and so on. And that's an emergency. It's also a common obstetric emergency and also a complication of pregnancy and also childbirth. So if you've had it before, the risk that you can have it again is still there. Your risk is a bit higher than others. So what we do is that first, when you get pregnant, so even before you get pregnant, you do all the things. Of course, you're eating healthy, doing everything that you need to do, exercise and so on. And then now the time that you are pregnant, by the time you get to 12 weeks, which is the time now the placenta has been forming and so on, we give you some aspirin. Aspirin helps with the placenta formation. Preeclampsia and high blood pressure in pregnancy is caused by the placenta the placenta is supposed to enter the uterus. They're supposed to attach to each other so that you can be giving food to your baby. That's how. It's literally tissues and vessels form together. So in that vessel formation, sometimes it's abnormal, and then many chemicals are sent out, and then now you get preeclampsia. Hence why it ends after you've delivered, because the placenta is out and the baby is out. So that's when they say, okay, after delivery, you're actually fine. Some people don't need medication.
Why did I have medication like for 2 straight weeks?
Just 2 weeks. Then it ended.
But the swelling was there for like almost a month.
But then it ended.
It ended.
So those effects will still be there, but then they end. It's not now you continue being hypertensive forever. So we give you aspirin at that point to help to help that process, to reduce your risk. We keep checking your blood pressure, we keep checking your urine, we keep checking the size of your baby, so that the minute your blood pressure even shoots up a bit, we started you on medication. Yeah, then we follow you up properly. Yeah.
I remember even my OBGYN.
Yeah.
When he's noticed nilianza kupata signs of when the pressure started going high because when we entered third trimester nayo ikaanza. Alinidunga dawa fulani, it's like adrenaline ya kuumesha lungs za mtoto. And then I was given another shot of the same thing when going to deliver.
Yeah.
So that the baby is able to breathe on his own. What's that dawa called?
Yeah, it's a steroid. So the steroid is supposed to help mature the baby's lungs.
Imeita adrenaline.
Yeah, it's okay. Yeah. It's okay. At least you know what it was doing. Yeah, so it's supposed to help mature your baby's lungs.
Yes.
Especially if you're being maybe induced earlier than usual. Maybe for 37 weeks or 37 weeks itself. We do that.
Okay. You've mentioned urine. Ukanikumbusha, that was when I was going for my clinics, that was the most, nilikuwa nafikiria naenda kupimwa susu na napata too stress. So you've mentioned finding protein in urine.
Yes.
Is it nice? Why?
Yeah, because it's a sign that your kidneys have sort of started to have an issue because of the preeclampsia.
So naturally, mtu afai kuwa na protein kwa urine.
If it's there, maybe a very small amount for whatever reason, but there's a specific amount we look at that shows, okay, there's something going on here. And together with high blood pressure, then we say, okay, this is now preeclampsia.
Because nikienda my last clinic, ndo daktari amue sasa the urine content, I mean the protein content was high in the urine. And remember it's very, very high. So whatever plans you have, wachana nazo, tunaenda kutoa mtoto.
So I know this question might sound funny, but probably after some audience are thinking like this. So then if is it are you referring to the protein I'm eating? Do I reduce the amount of protein I'm eating? Which protein is this?
No, it's not the protein that you're eating. It's just now the proteins within the body. Because the kidneys are supposed to sort of filter that protein, if I'm saying it correctly. So if there's a lack of like filtering, things are just passing through, then it means there's maybe an excess.
So my kidney is not functioning properly because I might be having very high blood pressure.
Yes.
Okay.
Yes, because and you see all the vessels are connected. These vessels are connected to your major organs, your kidneys, your liver, your brain, your heart, everything. So they get affected when there's high blood pressure. Because they're not also getting enough blood or they're getting a lot of pressure. So they also can start to fail. So those are the warning signs.
Aya, tukiwa tu hapo tu kwa urine. Tell me also why you are always concerned pia about infections, you know, the UTIs and all that. Because see, every time you have to test the urine.
So pregnancy predisposes women to getting UTIs more than the average woman out there for so many reasons, but some of them are as the uterus grows, it starts to press on the bladder. And then you find that the bladder either is always getting irritated or also at some point the bladder can just, sort of keep the urine there for some time. It's not letting it come out as it should be. Just imagine it's like a balloon being pressed by.
Oh, is that why it's zingine mtu anasusu drops?
A drop. Contact.
Yeah. So you're going every time you feel like you want to go.
Then
go,
drop.
Nothing. You go and then you feel like you want to go again. So such things predispose you now to getting infection. Yeah. And so now you get infection easily and quickly. And if those infections are allowed to stay for long, especially after your second trimester, then it can affect the baby.
Oh, okay. How?
You can go into preterm labor.
Oh, really? Oh.
If allowed to just stay the way it is. So we encourage you to always drink a lot of water just to sort of also just keep flushing. Yeah, but again in pregnancy, some people don't want to drink water. So it's a balance.
Teacher her.
Were you with me?
Teacher her. She said no pregnancy.
Yeah, I had a problem with drinking water. I just didn't like the taste of it.
Yeah, and that happens so commonly, which is sad. But we always say drink water with a straw. Put lemon slices, put orange slices, drink sparkling water. Just
Okay, I tried. I tried. Anyway, we shall try.
Ukaenda hospitali nurses wakamchekelea juu kunywa.
Wakaitana wote. Hebu kujeni muone huyu. Come see this one.
Hey.
She's not drinking water. What do we do with her? And in my head, I'm thinking, this is the team I'll come find in the Oh my God.
Seriously.
Imagine.
What are some of the signs and symptoms of fetal distress?
Yeah.
So, especially now in your third trimester, because now your baby has gotten a rhythm, you sort of know, as much as the baby sleep majority of the time, but you sort of know, okay, in the morning, my baby moves a lot more than in the afternoon. Maybe they don't move as much, or night, or whichever. So fetal distress, for the mother to know, you're sitting at home, you feel the movements are just not... They are reduced. They are reduced. And not in the sense that, because some moms say they feel like the movements are reduced, but what they mean is the kicking and the punching has reduced. Of course, when the space reduces, the baby is not going to be doing that. But you feel them
Somewhere.
moving.
Especially after eating.
So all of those are movements. But if you're just like, you've not felt anything in the morning and one movement in the afternoon, and now it's late at night and you're not feeling much, then that's reduced movements and it could be a sign of fetal distress. So you just go to hospital immediately.
In 1 hour, how much is the baby supposed to move?
So it's hard to know because the ideal is like 10 to 100 movements. So what we say is that if a mom feels like, the baby hasn't really moved much, then we encourage them, they can lie down on their left in a dark, quiet room and just try and count the number of movements. If they're about 10 or less than 10 in those 2 hours, then you should go to hospital. But there's no, like, this is the specific number of movements all through pregnancy. So it's when you have a question, that's when you lie down on your left because it improves blood flow to the baby.
Yeah.
And then it's quiet so you're not busy, so that you've not missed it. And then now you just count the number of movements, not even kicks, movements. Yeah.
Okay. And then I had an experience where umbilical cord ya mtoi wangu ilikuwa ina wrap around the neck. So I don't know if this really happened. So kuna time nilienda ultrasound and they're like, oh, the umbilical cord is around the neck. So do this, be more active. Wakisema alafu itatoka. I did that. I walked, I mopped, I did what, nini. Then nikaenda the test just before my delivery, the ultrasound, ilikuwa imetoka sasa. But then, nikideliver, so I was a very curious person, really peep. So, when I peeped, I saw the umbilical cord actually was still around her neck. So, was there a possibility that ilikuwa, then ikatoka, then ikarudi just before I delivered? And what are the protocols you follow during handling such cases? Because nimesikia pia kuna cases where maybe the cord can be small, so as you're pushing, you're struggling the baby. So how do you handle such cases? Kwanza niambie kwanza kama hii experience ilikuwa kweli ama kuna mtu alinidanganya hapa katikati.
And is the wrapping also a cause for concern, like one nini?
Around the neck? So it's not a cause for concern. You find that I have found that 90% of the babies that I've delivered, there will be a cord around the neck, whether CS or vaginal delivery. Because just imagine the baby is coming out, the cord is long, it's responding to gravity. Where does it wrap? Like it's naturally just wraps around the neck because the baby is going like this. It just goes round.
It's like when you put strings together. When you ukieka string mahali itajikuta saa zingine zime.
Yeah, it does its own thing. And the likely place it goes is around the neck as the baby is going down. So most of the time it's loosely around the neck and that's why you delivered and the baby was fine. That's why people deliver and the baby is okay. So 90% of the time it's fine. So when it's found on ultrasound, it is actually not supposed to be a cause of concern if everything else with the baby is fine, especially if it's loosely. It's true. So most likely it was there, then it came loosely, then it came back again. It's just loose. Okay. And then the process of labor, it's moving. They're moving together, so you find it comes out. Yeah. But there are cases where it is tightly around the neck. Like it's tight. Yeah. In the case you said even a short cord or it's just maybe gone twice and tied on the leg also. So when that happens, the baby is the one who's going to show signs of distress. And that's how you know that it is something dangerous. So if I see cord around the neck and you're 36 weeks, and it's loose and the baby is fine, the baby is moving, the ultrasound has said everything is fine, blood flow is going well, I don't get worried because I expect it to happen. But if it is tight and then there are signs that the blood flow is not going well to the baby, then we say, okay, then this is now an emergency. Yeah. So that's how we look at it. How is the baby? And often during labor, that's when you'll find, because the cord and the baby are both moving, so there are times it can start tightening. But see, during labor, the baby's heartbeat is always being listened to. So yeah, if there's something off, then that's when we rush for a CS. Then you say, oh, it was tightly around the neck. Yeah. So we wouldn't worry. Me, myself, my son had a cord around the neck from the time he was 34 weeks to the end. He was fine.
Yeah, because when baby came out, they rush, they're just removing something around the neck, and then the son later, and I was like, you think I didn't say that?
Yeah, but that's what we're supposed to do. Sometimes you're like, oh, there's a cord,
okay,
and you remove it. So that also they're not going back with the cord. You remove it and then you show them up.
Well, let me ask, is it my right do I have a right when I'm in hospital, nimedeliver, nafaa kudemand niekee mtoto hapa? If I want.
You can ask.
Because remember I have eye problems. So when my baby came out, niko theater, so
Acha tubalize kucheka.
Yeah, I have eye problems, guys.
So you didn't see the baby?
So
what has happened?
The baby came out, and I was like, I was told, here's your baby. I just saw a yellow thing. So what else you can't really change? I don't know. So nilikuwa nadhani I had romanticized it kabisa. Nilikuwa like,
ulikuwa expect to
nitekewa hapa. Kwanza I expected my husband to be in the delivery room with me. Nikaambiwa hospital protocol sawa. But hiyo part ya kuwekewa hapa, ningesema niekewe.
Yes, but CS, sometimes it can be a bit difficult because you have to keep it as clean, as sterile as possible.
Okay.
And you're covered from maybe just here. Yeah. So by the time they're trying to squeeze the baby here, it becomes a lot. Yeah, no, kissing is okay. Whether the baby should be brought to you, you kiss.
Mimi niliona tu kitu kia yellow nikasema
kia yellow kimepita tu.
Yeah, but it depends. Maybe you are in an emergency situation, so maybe they couldn't.
It was actually emergency, right?
It was emergency.
Yeah.
Now, speaking of emergencies, yes. There's this thing I saw on another podcast. This lady alikuwa anapeana birth story ya the second baby. So first baby was CS, emergency, but this second one was elective. And she was saying now the difference she experienced from the first na second. The emergency ni haraka we remove but with the second, and it took time to heal.
The second.
But with the second, since environment iko relaxed, tunajua we are giving birth on 30th of July 2020, whatever. Everything is relaxed. So even when you go, the doctors are there, they are well prepared, they're just ready for you. But emergency situations ni
rush.
So with the second one, she healed within 9 days.
Oh, really?
Yes.
Wow.
So nilikuwa nataka uniexplainie the need behind that. Is it because of the relaxed environment
or a relaxed mind?
Dr. Vera Sidika alituambia I didn't have pain. Okay, your part of course inaweza kuwa nini, but maybe she healed faster because both her children were elective CS.
Yeah, it's true. It could have been the mind, because that emergency, when you're going for it, it becomes a form of birth trauma. You've gone, it's theater, you need a big thing, it's major surgery. So by the time your mind is even, and it's your first baby, you don't know how to maybe even breastfeed. Like there's so much drama going into that postpartum journey. But when it's elective, of even the air, everyone is just calm. The doctor is calm. Music can be played. You're just familiar with everything. So maybe now that calmness led her into the calm journey, because it depends. Some people say the first one they healed faster, the second one they healed slower. So really that one depends. But I really do think it was the mind.
Okay.
And is there something basi service providers can do, hata kama ni emergency, juu nashtuka juu mumeshtuka. You know, I'm seeing you running everywhere. Twende. Is there a way they can maybe compose themselves or ama tukubali tu these ones are also humans, pia wao watashtuka, tukubali tu situation venye iko.
There's a way, of course, that we can try, but I also think when you prepare someone in clinic, you say if there's an emergency, it will be like this. It will be an emergency CS. These are the situations that could happen. If they do happen, you will see me rushing.
This is what will happen.
You will sign consent, or your spouse won't be allowed to enter inside. You know, that kind of thing. It can sort of prepare. So even if I'm rushing, because of course I have to have that sense
know
of
why
urgency,
you're rushing.
You know why I'm rushing.
This is why you need to sign up for the Malaica program. Because tell me why I didn't know I was supposed to sign a consent form.
So
Mimi nililetea tu makaratasi. Sasa hiyo was it
Aujui hata una sign nini.
ati anesthesia sijui nini hata una time ya kusoma nini. Imagine it's emergency CS, you don't even have time to read the whatever. So unaenda tu pale una sign mavitu.
Wacha nikwambie mimi ni when I was on that table and I'm pushing nikasikia tu huyu ni mdogo tumkate. I almost jumped off that.
Like, excuse me?
You will go watch our delivery stories. I was like, what? So, when do you decide that any episiotomy is necessary? Is it that sasa sisi ni wadogo sasa tukatwe? And what is even the procedure of kukata mtu and all? And then after you answer that, I want you to comment on there's this massage.
I'm feeling pain on your behalf.
Well, I didn't feel pain when mine was being done. Na nilijua nafanywa because I had read on it. So as I was delivering, nili notice the midwife was doing that. So I'd want you to comment on that, however you comment. But kwanza tuongelesha about episiotomy.
Yeah, so episiotomy basically, I wish I could draw, but it's you're cutting like
next time utakuja na dami. Next time we shall bring it.
Please come with the
people.
Yeah.
See,
watu wanafanya delivery vlogs. Delivery. Yeah.
Guys, I'm married to someone from the mountain. It's an excuse.
Yeah, so it's basically just cutting of the muscle and the skin and the tissue in between to give more space for the baby's head to come out. And it's usually done when the baby's head is literally almost coming out. So when the baby's head is crowning. And so when the baby's head is crowning and you see that it is... So it's not that the baby's head will not come out, but it's that it might come out and the tear might be very bad.
Okay.
So you'd rather control the tear by you creating a tear.
So the episiotomy is actually helping, saving the mom.
You're creating a tear. You're creating a tear just to now help just have control of just the way the baby comes out and having a controlled tear that is easy to repair. I don't know what example to give. If I tear this tablecloth just like that, to just be weird.
Yeah.
But if I cut with a scissor, it's easy for you to
sew it back.
No ukikata alafu bado atea. Does that happen?
Yeah, but it will tear along the line of that episiotomy. A lot of the time, yeah. You could still have many others, but a lot of the time.
What is the worst? What is the worst tear?
You should be injected with something to numb the pain, the area, before your cuts.
Okay.
So you're not just cut live.
No, nakatanga live.
Although, yeah, it can happen, but...
I think kuna wenye
kuna mtu aliniambia mimi nataka tu usikiangi ukikatwa utasikia afterwards ukishonwa
because your head is healthy. I think kuna watu like wani mimi wembe niitishwa nikiwa thank God I had
kakupea nguvu ya kusukuma.
But then you know I was like just give me one chance, I will push this baby. I did.
That's good. And you did.
I think it was just the trauma because nilikuwa nimesikia stories za watu.
What's the worst that can happen ukitea like kabisa the tear is too...
Yeah, so there are degrees of the tears, but once it reaches like 4th degree or 3rd degree, it involves, because your pelvic floor is connected to your sphincter, your anal sphincter, which helps you to poop.
Oh, inaweza enda
so if the tear goes to that extent, then now you have problems holding your poop in. You can have incontinence. Or if the tear is uncontrolled and really there can be a connection between the vagina and the...
And can that be repaired?
It can be repaired. But of course now it becomes just it becomes a more complex repair.
Remember that story you were saying about poop? That
We
one.
actually know we are gonna bad man.
No, see, you brought up,
Ligani yo.
like that urge you feel after sex to poop.
I was telling
imagine-
her. Oh, we have a guy now here. Maybe she can confirm.
Sasa unasema tabia mbaya nini?
So, tunaongelelea something totally different. So,
Are we going there now?
we are going there now.
We are inside.
We are
We
here.
cannot climb out. Okay. I don't know what you're talking about. But
So now let me tell you. So I was sharing with her. There are people, but after we deliver, especially if you've done vaginal delivery, after sex, especially maybe after an intense orgasm, you'll have the urge to poop. Well, not that to poop during the act, but you see the way you'll want to go to the loo and susu. Now you'll want to go to the loo and susu and also poop.
Yeah.
So is that something true? Ama mimi nasema vitu zangu ama ni mimi pekee na
Ni wewe hujafanya research ama ni kweli?
You come and told us something that you cannot confirm scientifically. Anyway, no. But I don't think it's about birth. I think it's just generally that happens because the uterus, vagina, rectum,
They are around
and
there.
the bladder, they are all very, very close to. They share like. Don't know what to say, floors and walls and ceilings like that. So of course, if maybe your uterus is contracting, you might feel it might also irritate the area of the rectum or the bladder, hence why you will want to pee as well. So that is, and when you have an orgasm, everything contracts.
Yeah.
So that is the theory, but it can happen whether you have given birth or not.
Or not. Is it more for someone who's already given birth? Could it be? Is there a possibility?
There's a possibility.
Nataka tu kuconfirm.
I know. I'm like,
Nataka tu kuconfirm. No, I just want to confirm
Yeah.
because I have actually listened to women in their 30s, 40s talk about this, and they refer it to giving
When they
birth.
give birth. Yeah. I mean, unless now, because the pelvic floor does become a bit more relaxed after delivery, so
Yeah.
maybe that connection you feel it more. Yeah, you feel it more. Maybe it was there before, but you feel it more after.
Yeah. Ni vizuri ni confirm niki experience kitu kaa hiyo nisishtuke niseme okay Lisa at least
alikuwa ameniguide.
Yeah. Now back to this massage.
Yeah.
Ebu, I don't know, is this massage necessary? Does it really help as they say it does?
Yeah.
And how soon should you start doing that massage?
Yeah, so there's research that has shown that it does help even if you do it maybe before. So maybe at your last doctor's visit when you're 39 weeks or so, you can be doing it. You can also do it at home.
Yourself.
You can, You can just try and it's like massaging that area. But the research is not that strong. So maybe you might not find every doctor doing it for you. That's now the one for before.
Yeah.
Okay.
During delivery, naturally, yes, we do. It's sort of a massage. You're sort of just also
So
determining
acha tu I wish tungekuwa na dummy. Acha tu explain. So I don't know, is it the muscle ama ni
Yes, it's the muscle now at the at
your
the bottom
vaginal
of the
opening.
Yes.
At the bottom of the opening.
Yeah, so it's not inside.
Yeah.
It's just around that outer area.
Yeah, like this.
Like that,
Yeah.
exactly.
Ndio napenda hii
That's the
story.
massage. Yeah.
Who has bad manners now?
Yeah.
Easy but manners, I'm helping you.
I don't know what question will come next. I don't know what's going to come next from you, but it's fine. Yeah, so then there's that now. That massage sort of just now helps to relax that muscle. Especially as now the baby's head is coming out, it might not be as tight or you might not tear as badly. But it is not something that if you don't do it,
Things will be bad. Okay.
And how do you handle breech births? First of all, what is a breech birth and how do you
handle it? Yeah, so with now modern technology, ideally if you see that your breech at 36 weeks or beyond, then we know, okay, it's a breech birth, you need a plan. Because the natural way that the baby is supposed to come out is with the head. So when it is not the head and it is the bum, or it is
the legs.
the legs or the thighs, then that is now considered a breech birth. a breech presentation or position of the
Yeah.
baby. So when that is there are options. We either tell you, okay, it's a CS, which is still an option, or we do something called external cephalic version, which is literally trying to move the position of the baby from outside. So we push the
Ni ile
baby,
mama alikuwa anafanya hiyo massage na mbo uende massage.
and then they go round and round.
They go round and round mpaka baby akue kwa hiyo position ya.
Na nasikianga ni uchungu.
We try to relax the uterus, but it's uncomfortable because you're literally moving a whole baby like that, and you have to do it in a controlled setting in a hospital, and you ideally do it after 36 weeks so that if anything changes and the baby goes into distress because of that, you can go for a CS immediately. Yeah. And then what was the third option? The third option is a breech birth, but we do not routinely do that. Like, oh, your breech at 36 weeks, let's wait until 40. We rarely do that, but in other countries they do it, and it can be an option.
So they leave the baby like that. They wait until your delivery time. Na tuta deliver mtoto akiwa in that position. What do you mean?
Yeah. But it's a difficult delivery, and many complications can occur, including even the baby's head sort of getting trapped. So we don't routinely give it as an option as doctors. In fact, a lot of the time people are told, okay, you'll go for a CS. But there are cases where someone is in labor, they have come to hospital,
The baby
they
is
are pushing out the baby, and the baby is breech.
So do you like put your hands in, turn the baby?
No, we don't turn the baby. So if the baby is now coming out as breech, then we are taught, doctors and nurse midwives, how to deliver a breech baby. Because there's a way that you specifically deliver them. So that the legs come out, then you sort of wait, now, the hands come out, you remove one hand at a time, then now there's a way you remove the head.
Na si mama basi ameng'ang'ana.
Mi niko kwa huyo mama sasa. Niko na yeye.
Yeah.
And how do you ensure, because I imagine there's a lot of pain during that process, how do you ensure you've retained attention at the mom? She doesn't pass out, she doesn't get tired, because you still need her to push.
Yeah, so it's just like normal labor. So you're just telling her, push now.
Okay.
Push. Do this. Okay. So you're just instructing the whole way. Yeah. But I think commonly whenever you see that someone is delivering breech, either the baby was small, or it could be the second twin. In twin delivery, sometimes that happens and you let it be.
Kuna hii swali nikataka kuuliza. When I go to hospital to deliver vaginally, am I allowed to ask now the doctor ama nurses that I want to deliver in a squatting position? Do I have that freedom? Ama mtaniambia tu wewe lala sasa? Yeah. But I hear it's the easiest.
The squatting.
The squatting position is the easiest for many moms. Nimesikia wakisema like that's the best option.
Yeah.
So do you allow that? Ama
or which one is the best? May I really desire to do the doggy whatever, where you're on your knees, but it's an option.
Si utapata
ama ni pesa mzuri ama
okay, it is good. Even standing, all of that, because it's gravity and naturally even you when you're in that labor, that moment, your natural feeling is not to lie on your back. Most women, you see them squatting in that position. So I would say that you have the option of asking for it, but speaking for some doctors or maybe for myself as a doctor, I might not have as much control because now, where is the doctor going to be as you're busy squatting?
You squat for your bed.
You squat on the bed, so it means you really need people. Then you're squatting, and at that moment you could easily fall. So I advocate for like squatting, then all of those things right before the baby comes out.
Like now we are ready.
You're ready. So
squat.
please stand, squat. It really even helps the baby coming out.
Yeah.
But the moment that you make that, the baby's head is literally crowning, I'd rather now we put you on the bed and you just push out the baby. But it does help. It does help.
Okay.
For you to push out. So I feel like that is my sense of control for me as your doctor. That do all of that. But the minute the head is coming out, you're literally not even going to push much. It might just be one push and the baby is out.
Let me ask you, have you ever delivered a baby unawares? What I mean is, I don't know, kwa street, kwa gari. Mtu amekam kwa hole, already the head is there. Have you experienced that?
Yeah, actually. Yeah, but it's always in a hospital setting.
Okay.
Like they've gotten to casualty. And
wameingia tu.
Even breach, same thing, they've reached.
And you've had to do it there, mali umempata?
You have to do it there. Yeah, you just do it there and then. Yeah.
So what do you do? Like tear off her clothes? What do
you lift, most of the time they're wearing a dress, you know, lift up the dress, you call for help because you always have to work as a team. And then there are always things, there's always a way. So it's always been in a clinic or in a hospital. Yeah, then you manage because naturally the baby will come out.
Umonda mingi. Mina faint.
Like, sorry.
Like the dads who go to the delivery.
Una faint.
The 7 stages of grief before.
You think to spend the whole situation. Like, okay, why were you here?
Why were you here?
And how do you handle cases of uterine rupture?
So uterine rupture, again, to explain, is when the uterus and its muscle, it tears. Basically, it's tearing open. And the risk factors are if you maybe had a CS before, although it's a very small risk, but it's a risk. And at the point of the scar, because the scar is very weak and you're contracting, it can easily also tear. And it can be fatal for you and the baby because you lose a lot of blood and even the baby now is even out of the uterus. So in such cases, and maybe there are rare cases, but there are cases where someone is trying their scar. Basically, they've had a CS and now they want to try and do a vaginal delivery. And that is okay. 70% of them are okay. VBAC, they deliver well. But we observe you so carefully that we listen to the baby's heartbeat. So if the baby's heartbeat changes or the mom's BP starts to drop or there are just signs that she's bleeding abnormally or even the pain is, out of this world, then we know, okay, this could be uterine rupture. Let us rush to theater immediately. So it's more about being very keen about and having a high index of suspicion that someone might be having a uterine rupture and dealing with it. But either way, we deal with it by going to theater and you repair what you can. But if the rupture is too much, the blood loss is too much, there are cases where we remove the whole uterus to save the life of the mother.
You've mentioned removing the uterus kabisa forever. Can I still have sex without a uterus?
Yes, you can still have sex without a uterus because your vagina is still intact, your cervix is still intact, you will still have enough lubrication, you will still have your libido because your ovaries are still also there. Your ovaries,
so bado ntanyesha?
The hormones, no, you will not, because your uterus is the one that sheds its lining. So what happens is the hormones communicate, the ovaries are there, ovulation even occurs, which is fine. But there's no, and the uterus prepares itself for a baby. Then if there's no baby, it sheds its lining. But it's just based on communication from the hormones and the ovaries.
So my eyes inaenda wapi, doc?
They're there with your
Ziko tu
ovaries.
hapo zina.
You've left them there.
Si zitaja.
As it regenerates zina.
You will keep, it's okay.
You'll function, no
still
So
function.
zitafika tu hapo ziambiwe, hakuna mahali pa kuenda, kaeni tu hapo, zikae tu hapo.
Yeah, because they actually don't really travel. If you've not, are we going to cut? Okay, fine anyway. If you have not, if there's no fertilization, then they'll just do what they do. The only difference is that you're not going to have
blood.
You're not going to have blood.
So the bad egg, the egg that is unfertilized, will still come out?
Yeah. So what it does, it comes out. It's like microscopic. So it's never involved in that actually falling out.
And that small thing makes a baby.
Yeah.
Wow.
It's not the one that's involved in coming out of the uterus that you find you're bleeding. No, that one it disappears. It's self-absorbed.
So my ovulation juices will still be there. That's very important.
That's what you wanted to know?
What you want to know? Yes.
The best time of the month, guys.
That one?
You know.
I know.
That's high-fiving you guys.
That's why. High five. Yeah. Wow. So what I'm hearing is the uterus is iko kivyake. It's in It's like tu akibagi
It has a mind of its own.
It has its own life.
Like it's separate from the vagina completely.
Yeah, well, it is still connected, but if it is removed, the
You have a
vagina
way
is
of-
still there.
okay.
Yeah.
So the sperms have nowhere to travel to. They just linger.
Zitakuwa protein,
Yeah.
tutaongeza hips. Yeah.
Our doctor here, ashawaambia.
Yeah. Lisa is like, wow.
I knew this is where we're going to
Oh God.
But it's okay. It's
Yeah. You see, it's true.
Yeah,
No, nyama ya bure.
No,
protein.
it's not.
It's not true.
No, it's true. We reached here, but it's not true that no hips will come. No.
Yeah.
I don't. See, I thought zitakuwa absorbed as protein.
No.
Actually, it was my primary teacher who told me this.
School of medicine, which one?
Wow.
Na teacher wako wa primary mnaongea aje hizo story?
Sitaivia
Was it
sana.
a he or a she?
It's primary.
Primary.
No wonder. And it really stuck with me. Yeah, alituambia
Oh
the
my.
excess sperm is protein.
Uh-huh.
And it helps develop your hips. And me, because I'm a good student, I listened in class.
Hey,
It stuck
in
up
primary.
Oh my.
Oh my, wow.
Oh my.
So as Ebu asiende ashikwe,
Yeah.
and the way he was
More like
abusing the minds of young people.
Yeah.
Explains a lot.
Yeah. No.
Ndio mimi naona ndio maana and then mimi ndio naitwa niko na tabia mbaya kwa hivyo. Guys, you can see for yourself.
We have seen.
Yeah, but I'm just echoing what I was taught.
Oh.
Ni mwalimu.
It's not you.
It's not me. So now let me ask about when now mom is in hospital, she's getting to deliver. Of course, kuna procedure mnafuata to ensure the mother is in good condition. The baby is in good condition. Can you take us through some of those steps you take? Like the monitoring things you do.
Yes. So getting to hospital, we usually, in some hospitals and not all, but we listen to the heartbeat of the baby. There's something called a CTG where we connect. So it's sort of like just something to listen to the baby. a
That's
Doppler.
the thing yenye inapitwa na tape.
And then another part we connect to feel like to monitor the contractions. So we let it go for about 40 minutes or an hour.
I hate
or
that
20
sound
minutes.
it makes.
Yeah.
And
Give me
which one is
trauma.
more effective? That one ama ile daktari anakuja hivi na kipai?
That one is more effective because
Okay.
you listen for 40 minutes. You know, in 40 minutes, like even us, we have done a lot. We have been calm, we have laughed, we have, there are things. So the heartbeat moves up and down, up and down.
Yeah.
We've undergone stress, how have our bodies reacted to that. That listening, the doctor might listen at a time when the baby is good, but maybe
Akienda
there is
hivi
stress.
something. Oh,
Yeah, so that's the moment the heartbeat sounds good. But then when they remove, the baby is distressed in a way. Then, so you can't catch that. But with that 40 minutes, you will see. You'll see, she had a contraction, the heartbeat dropped. Then it came back to normal after the contraction. So you see, maybe the doctor will listen when a contraction is not there and say the baby is fine. The baby is in distress because of labor, because now the contraction has happened and the baby's heartbeat has gone down. So basically we read it. It's like a graph sort of thing that we read. So that's monitoring the baby. The mom, we check your BP, we check your pulse rate, we check the way the oxygen is flowing, and now examine you vaginally, is everything okay there? So those are the ways. And then all through the labor, we are monitoring the baby's heartbeat. Now that's one we can do once. And then also the mom, we are checking how are your vitals, how is your BP, how is your pulse rate, how is your pain, are you bleeding? So we monitor you all through, all that way, until the time for labor. And then after delivery, the baby is examined head to toe. Is everything okay? Is everything intact? Is the baby breathing well? Is their color okay? Is the heartbeat good? Do they even have is there like a hole, like an anus? Is there,
Oh,
can they
really?
Yeah, everything you're checking then. Yeah, and then also the mom, now we examine you fully and make sure there are no tears, there's no excess bleeding and so on. Then now you go together.
There's this videos, nimeona videos mtoto after delivery how they are checked, atashikwa afanye hivi, arushwe hivi, ashikwe hivi na mikono afanye. What is that?
Ile kuslapiwa pia.
Kuslapiwa.
Kwanza kama hali.
Anashikwa hivi na kimkono kimoja, alafu anaketishwa then anaachiliwa abruptly, anainuliwa.
Okay, maybe it's not as dramatic, but it's,
okay.
It happens.
What are you saying, Doc? I'm being dramatic.
Anaekangwa upside down alafu anagongwa ass.
That is back in the day. Yeah. The point is to stimulate the baby to cry, because when they cry, the lungs open. We don't slap them anymore. You just have to wipe them. Just wipe them.
Wasikie kabaridi.
Yeah, then they cry. They cry, so they're okay. So that's part of it.
So your process yote niliona kwa hiyo video, it was just to make the baby cry.
It was a spanking, but maybe the one of like
lifting and letting go. Yeah,
they're trying to also see how it's like called muscle tone. You're just trying to see if the muscles are functioning well.
Okay.
You don't also need to throw them, but there's a way that the pediatrician or whoever is knows how to control that and see if they have enough strength or not.
Okay.
Yeah. Okay. So I don't dispute. It's there, but there are now more relaxed ways.
Okay, of doing it, because I was like, hey, this baby is so tiny. Hey, you know. Okay.
Yeah.
So following a complicated childbirth, how do you support moms? Like, how do you help them take care of themselves after a complicated delivery?
So of course we tell them the best thing is education. You've had this complication, maybe you've bled a lot. Please monitor for further bleeding down the line, even when you go home. If you're changing more than one pad every 30 minutes, that's a danger sign. If you're dizzy or you faint, that's a danger sign. If your heart is beating too much, it could be a sign of anemia. That's a danger sign. So education is very important so that they know how to take care of each other. I'm using bleeding as an example, but there are so many. Eat, diet rich in iron. Yeah. Do that constantly. Keep hydrated. Come back for your checks. After 2 weeks, if you're told to come back, you come back for your check. So that's the way we talk about now taking care of yourself. So whichever complication, even now, preeclampsia, high blood pressure, you're going home, go with the BP machine, check your blood pressure. These are your targets. If it's higher than this, let us know. If you have these symptoms of severe headache or pain or the swelling might be there, but if you have them with the symptoms and the high blood pressure, come back or let your doctor know.
Mimi najua nilikuwa hapo kwa najua diastolic na systolic.
Exactly. Thank you. So
I had to get that machine.
You have to, yeah. So education is key, and then you're told according to your complication, this is what you need to do in the long term.
Okay.
Well, do you feel educated?
I feel educated a lot. And imagine, again, our audience. This is Lisa, an OBGYN from Malaica. Imagine at $4.99 bob per month, you have such minds around you at your disposal. Imagine. So make sure you go follow them on all social media platforms. Your email again was?
Malaica.com. The website is malaica.com. Malaica with a C.
Malaica.com website. Tutaiandika hapo ndo usikwe na excuse. Uende, if you're not in social media, watafute uko kwa email. Contact them.
Yes.
Yeah, the moment you contact.
Road, Plaza.
Yes, please. And the moment you make contact like this, watakuweka kwa hiyo WhatsApp group where you have such experts there at your disposal. You can also inbox them if you need. They're available from 9 a.m. to 9 p.m. You also get access to a social group. Very important. Tutasisitiza hiyo hadi tujue imeingia na imeingia hadi uko kwa to stick. You need that society around you, psychological help, such information at your disposal. Imagine
na your information, like we said in the previous episode, when you have that information, you won't go there with fear. You'll go there knowing what to expect. Hata kitu kienda vibaya, auta panic as much.
And you'll also enjoy your journey. And Malaica, imagine these people work with you even after delivery. What else can you ask for as a mom?
And in this episode, we cannot emphasize the importance of care for pregnant women and postpartum
Yes.
mothers. We can never emphasize enough. Because when I posted that TikTok, how a woman will remember how you handled her
when
during
she's
pregnancy and after. Comment section. Yeah, the comments. All those women who
people are hurting. People wanatendwa.
Endeni kwa hiyo Malaica. Endeni Malaica you need Malaica.
Tumewaletea help. Young moms too. Sindio, you're a young mom, you feel some type of
umechanganyikiwa sana.
Imagine once you get in touch with the community, utapata some of those problems will end.
Then you'll bond with other moms.
Ulisema mna meet pia, people are coming with even their children.
Tafutia watoto play.
Mnatengenezewa hadi hangouts. Surely. For free? The hangout is for free?
Yes, it's for free.
Wendo kukule chakula ya free.
When chakula tu. I'm the foodie in this relationship. Do not try to take my title. My last question maybe would be easy complication. Like which one which one can you say was the toughest and how did you come out of it? The one, the toughest, maybe ilikuwa most successful.
Most successful. Oh. Okay. There are a number, but I'm trying to think of the one that was...
ulitoka hapo ukifeel enyewe. I was made for this job. A complication that ulitoka hapo ukifeel enyewe I've saved 2 lives.
Yeah, for sure. There are many. There are a number.
Hey, ata uringi, there are many.
No, there are many successful, but there are also some that have been unsuccessful. So I feel like that's what came to mind. But let's not discuss the unsuccessful. But the successful, there are a number. Let me try and think.
Maybe tungeanza na how many babies have you delivered since you started your career?
By the way.
I don't know.
So we don't know.
You lost count.
Yeah.
Watu wadozani
wenye pilots wana counting the hours. Like they're judged based on the hours they fly. Okay. So you can't remember the children.
Lose count.
Lose count. But they're all good. I feel like there was one. Let me try the most recent one. Well, not most recent, but most recent complication was it was a CS. And it was supposed to go according to plan. The baby was just not okay at that point. So the successful part is the baby came out and thank goodness and thank God everything was fine. But then once the CS was over, you're just seeing some bleeding and the heartbeat. I mean, the blood pressure of the mom has gone low. And you're like, what has really happened? Like we finished. We finished and we're like, good.
Hadi mumeshona kidonda.
And she's just like, I'm feeling lightheaded. And you're like, what is this? And it keeps going down. And in that time, there's a decision you could say, okay, let's wait and see, let's observe, let's, figure it out. But then you just saw now she started bleeding heavily and the decision was made to open her up immediately again, just then. And she's bleeding too much. So we had to remove her uterus. But what I think is that it was good that it was done then as opposed to waiting.
Yes.
And then maybe she would have lost her life. For sure. So we removed her uterus, but at least she just went to ICU for a day. And then she was out of ICU and she went with her baby and that was fine. So as much as she lost her uterus, at least her life, for me, I felt like it was a success because her life was
saved and she has her baby.
So for me, I would say that is successful in my books. Okay. But we always do things as a team. Let's never say that it's the OBGYN themselves. Even if they say it's them themselves, never ever. There's always a good team of nurses, of everybody plays a part. Even birth partners play a part. Let's never forget that.
Msema team nikakumbuka when ukienda CS doctors our team wanakuwa required to introduce themselves to the patient. Why?
so that even you can take stock and know this person is
He's
this,
the one who injected
this
my
person
back.
is the one who did this. Yeah, you need
Yeah.
to know. Yeah.
Okay.
Yeah,
It's for,
they could
it's for
be
that reason
imposters.
only.
Yeah, they could be imposters inside there, and it's good for your education. What is the role of this person? What's the role of this one?
Muko
Yeah.
mumejaa hapa
It's good to
why?
be aware.
It's
Yeah.
good to be aware. And everyone introduces themselves and says what they are there to do. Yeah, so they're not just saying my name is, whoever, but they are saying I'm here and this is my job. I'm here and this is my job. It's good.
Na hapo kwa CS, after removing the baby, ama during the process, daktari anafaa nipigie story, mimi the patient.
Yeah, it's
Because kunikeep.
Yeah, to distract you. Okay, well, not to, but to just keep you engaged. Sometimes it's to distract you so that also to remove your fears. And it's also part of education. So it's not just weird silence, then a baby cries and the baby has come out.
Because, like me, that day I was supposed to go for a show in Ngong. And I kept telling the doctor, acha niende Ngong.
Wow.
Sikusema naenda ration. Nilimwambia naenda Ngong, nitakaa Monday tufanye hii kitu.
Wow.
Kaniambia no, it has to be today. Like unanipangia aje ni leo. So when he was teaching me up, akaanza kuniambia twende Ngong sasa. So I think hiyo ndio ilikuwa his way of keeping me in your
keeping you well, not only awake but just keeping you engaged and removing your fear. So that was good of your doctor.
So that means if maybe I'm looking for a doctor nichague mtu pia naweza have conversations na yeye. Si mtu tu tumefika kwa ofisi amenyamaza tunantasha.
Ako hapo for business only.
Business only. Okay.
Purposes,
Another question. Mbona mtu after delivery unasikianga baridi? That's nothing can cure. Because tell me why after delivery it was fine until nimekaa hapo nimewekwa nistabiliziwe. I was shivering, nimevalishwa blankets ka 4 za hospitali. Bwanangu ameniongezea masai blanket. Heater iko on, but I was still
feeling cold.
Yes, in that time
okay.
I passed out and then nikaamka sasa ndio nikaanza kufeel pain ya CS sasa. What's the reason behind the shivering?
Shivering. So there's medication that we give you apart from the oxytocin in some cases. So not everyone will shiver a lot, but there's medication we give called misoprostol cytotec, and it helps to contract your uterus and to prevent further bleeding. It's very helpful. So one of the side effects of that is extreme shivering. Extreme shivering. Nausea can also be there and so on, but there's always extreme shivering that disappears after some time. So it's likely that's what you are given.
For nausea niliekewa katembe hapa chini.
Also you had the shivering and the nausea.
No, I didn't have the
You didn't have the nausea.
Nilipewa tu nikaambiwa hii ni ya kusaidia usitapike. So hiyo shivering some vaginal mom pia wanasemanga
some of them.
So chances are walipewa hiyo.
It's part of that preparation or prevention of postpartum hemorrhage. Those who are at risk.
Okay.
Makes sense.
Okay.
Hapa tunaweza kaa na maswali hadi kesho.
I know. One last one as we finish up. Doc, as you're going to deliver your kids, unasikianga je kwa akili? For example, as a photographer who is maybe doing their wedding, anawashwa achukue hiyo picha apige vizuri, you know, but it's their wedding. Sasa wewe ukideliver
a pregnant doctor.
Exactly.
Umeenda unasikia kuambia toa hii
wewe ufanyi vizuri, fanya hivi, you know.
It's true, the pressure to be on your best behavior and inside you're a patient. You're a doctor, you're a patient. So you're like, I don't want. I had to undergo an emergency CS. Of course, you're like, okay.
Tell me you want to instruct them. Kata hapa vizuri.
No. You're just thinking, is this baby going to be fine?
Okay.
It's going to be. Of course, you're anxious. Am I going to live through this? Will I not live? Like everything that, it's like you're just not a doctor. That time you
switch off. Okay.
You switch off, But there's still that pressure of,
you want things to be perfect
in my workplace, so I just felt like this pressure
family
for the people there. It's nice that they are there, but also let them not go and say that she was crazy.
Okay.
She was screaming, that she
this
was
is still
what?
my job.
This
Please.
is, this is like, let's say, just like, let me be on my best behavior.
Yeah.
But I mean, it was very nice either way. Yeah, so you still...
Because I now imagine kama mungeenda vaginal,
Wow.
manduru ulikuwa unapiga.
And that was my fear. I was like, wow, what's going to happen now? I will have to be, let me just have an epidural first. But yeah, that was my plan. Yeah. But you switch.
Yeah. Uta instruct watu huko. Shone hiyo hapo vizuri.
You cannot, it's like
Nasikia hapa nika umetight sana.
Hebu luze.
Never. Your life is in your life is in the hands of God, but they are also them. They're there.
So you choose to trust them.
You choose to trust them because you don't have a choice.
Yeah.
You're not going to do it yourself. Yeah.
Okay.
Oh, I've enjoyed this conversation so much.
Me too.
Thank you, Spencer. Aki urudi tena. We have so much.
You will have to
many
come back.
things
There's so much to cover.
For sure. But I also enjoyed myself.
Oh, tumekubamba, tumekunais.
Inafaa
Very
utafute.
nice Friday. Very nice.
Nice. Thank you people for tuning in. I'm sure Melan as much as to Melan. Please tell us what you've learned up of our comment section. Ask your questions. Lisa has promised she will go through the comment section and she will answer your questions. And also, please reach out to Malaica. Make sure you apply for those groups. Utasaidika. They also have clinics. Please tell us more about that.
Yes, so we have clinics for 3,999. They are on Ngong Road, Dekio Plaza. And in the clinics, you get a consultation, you get the lab tests you need at that time, an ultrasound, access to a psychologist as well, all in that same price, which is a good deal. And we also have our delivery packages, which is 69,999 for vaginal delivery. You go with your Malaica OBGYN and you're delivered. Or if it's a CS, 169,999. You go with your Malaica OBGYN. All of these are very good prices for the quality of care that you get. Without a doubt.
And you're also collaborating with Avenue
Hospital for the deliveries.
And they work with you all through, even
from pregnancy
after
to now.
Yeah.
Where you are now.
Na sisi tuko 3 years postpartum, 2 years postpartum, they still work with you. So hawatakuacha. Until next time.
Adios.
Bye-bye.